Good morning and welcome to the Certified Nurse Assistant program through the Short-Term Allied Health Training through Health Sciences here at Ozarks Tech. We're going to talk about some classroom expectations such as actively participating in the program, be engaged with your instructor, punctuality, be on time. Class starts at 9 o'clock, you need to be here at 9 o'clock. When clinical starts, you need to be there when clinical starts. You will be in class 1 day a week from 9 to 3:30, and you'll be in clinical 2 days a week for 10 hours each day, so that's 20 hours a week of clinical. You are required to have 75 classroom hours and 100 clinical hours by the completion of this 8-week program in order to sit for certification. Become prepared, have all assignments ready and questions ready for your instructor. Respect your instructor and your fellow classmates and your clinical classmates. Also show professionalism at all times when you are in the classroom and in the clinical setting. Remember, this is a 100-hour job interview basically. These people are watching you and willing to hire you for a job. Make sure in the clinical setting you maintain professional conduct. Always act as if you are working. This is a 100-hour job interview. Attendance and dependability. Be there when you say you're going to be there. Be there on time. Do what you say you're going to do. Never say it's not my job. If it's in your scope of practice, it is your job. Teamwork. Make sure you can work as a team. Make sure you can work with the fellow CNAs already employed there, along with your coworker, your classmates. Patient safety. Never doubt patient safety. If you feel that you cannot safely move a patient or safely help a patient, you get assistance. Ethical behavior. What are you doing when people are not watching? Make sure when it comes to your skills check and your time logs, you're not fudging hours or skills. Make sure you're doing all the right things. Presentation. Make sure you come looking presentable. Your scrubs are clean. We provide you with scrubs in this program. They are clean. They do not smell of smoke or other substance. No body sprays or perfumes. Patients sometimes have allergies to that. Make sure they're not ripped, torn, stained, dirty. You get 2 sets. Make sure you keep them clean and in good shape. Accountability. Own what you do. If you make a mistake, own it. And communication. Make sure you communicate with your faculty and staff and your instructors and everybody and let them know what's going on, because we are not mind readers. If you're going to be late, you need to let them know and have a good reason why. Vaccine requirements. COVID-19 is no longer a required vaccine, but if you've had it, they want record of it. So make sure you upload that into my record tracker, which we'll talk about in just a moment. Flu. Flu is required during the flu season unless you have a pardon from the clinical site, and that has to be approved by the clinical site, not by OTC. Hepatitis B series is highly recommended but not required. If you have it, we do like to know that you have it. So please let us know by uploading it into my record tracker or signing the declination stating you will not be receiving it. Same with the COVID-19. If you're not going to get it or haven't had it, you just have to sign a vaccine acknowledgement form and upload that. MMR, you should have had these as a child. If you do not have access to your childhood records, then you can get a titer drawn, which is just a simple blood test. They'll draw and see if you're immune. If you are immune, great, just upload that titer. If you're not immune, then get a booster and upload that as well. Varicella, you need to have the varicella vaccine or immunity. Just saying I had the chickenpox as a kid is not enough. So make sure you either provide us with proof of the vaccine or a titer showing you're immune. Tdap. You must have the pertussis. If you only have tetanus, that is not sufficient. So make sure you go and get a Tdap. It is good for 10 years. As long as it does not expire in the middle of your clinical rotation, it is fine. Your TB skin test or a quantum gold blood test is sufficient. If your TB test comes back positive, you will need a chest x-ray. This is only good for 1 year, so if you expire in the middle of your clinical, you need to have this redone before clinical starts. My record tracker is a system that we use to upload all your vaccines, your background check, your urine drug screen results, and a copy of a valid photo ID both front and back. You'll receive an email from the clinical coordinator discussing how to set up your My Record Tracker account. If you do not log in a week's time, you will have to call and have them reset your password, so know that you need to be active in this account. Make sure you get this set up. You will have this several weeks before class starts. My Certify, this is where you will do your background check and your urine drug screen. You will receive the results just as we receive the results. After you receive these results, you need to upload them into your My Record Tracker account. When it comes to your background check, it's done completely online. You plug in the information, you upload it, and it takes care of everything. Depending on how many times you move can determine the length of time it takes to get it. So do not wait till the last minute to do this. Your drug screen, once you pick a spot for your drug screen and print out your form that you must take with you, you only have a few days to get this done. Do not wait till the last minute. Make sure you know what their hours are, where they're located, what their requirements are, what kind of ID you need. Do not take children to the testing facility. And make sure you can give them an adequate sample. If you miss your first appointment, we will give you one additional appointment. If you do not make the second appointment, you are dismissed from the program. So make sure you do not wait till the last minute to get this done. If you are on prescription medications that have to be approved by a medical review officer, otherwise known as an MRO, they will contact you to take care of that. Do not give us your prescriptions. We do not need that information. If you test positive for marijuana or CBD that shows up as positive for marijuana on your drug screen, this will lead to an automatic dismissal. Those are maybe state allowed, but they are not federally allowed, and we follow federal policies. Drop dates. This is an 8-week program. That means drop dates are going to come very quickly. Make sure you have started your My Record Tracker account and your My Certify account, and you've got these things going. If you do not have these started by the last day of the 100% drop period, you will be dismissed from the program. If you have them started, we will let you go to the 50% drop deadline. If you do not complete them by the 50% drop deadline, you will be dismissed from the program. However, if you are in the process of trying to get everything done and for some reason have hit a delay and you want to remain in the program, you have to reach out to me directly at williamm@otc.edu, and I will make sure you stay in the program. However, if things are not completed by week 2 of the CNA program, you will be dismissed because you cannot meet the clinical objective of this program. Chain of command. Your clinical supervisor is your go-to for the clinical site. You do not go to nursing and complain. You do not go to other CNAs and complain. You take it to your clinical supervisor. Anything else can get you written up or dismissed. If you have issues in the classroom, make sure you go to your instructor. Your instructor is your first go-to, not your classmates, not gossiping. If you feel like you do not get anywhere between the clinical supervisor and your instructor, you need to come to me directly as the program director. If I cannot help you or you are not happy with my answer, then you need to go to the Dean of Health Sciences, and his office is located on the 2nd floor of Lincoln Hall. If you have any questions about the program, you can always reply or email our direct program email listed here on the screen. Also, be on the lookout for emails from our clinical coordinator on how to set up these other accounts. You may get an email directly from Certify or directly from My Record Tracker. Pay attention to these. Do not ignore them. Once you are enrolled in the program, you need to be checking your OTC email daily. Check your spam. Saying you did not get something when you now know you need to have these things done is not an excuse. You should be getting an email at least 2 weeks prior to the start of your program. We are committed to providing you with the training tools you need to have a rewarding experience in this class, but you have to do the work. You have to put in the legwork and do your background check, do your drug screen, upload your vaccines, upload your ID, and do everything asked of you. You are required to go to the bookstore, get fitted for your scrubs, order your supplies, and be ready on the first day of class. Thank you, and we look forward to seeing you in class.